Back here on the Q96.5 FM, and we are in the middle of the medical hour right now, all brought to you by the medical specialty clinics at the Bryan Hospital and the community health professionals. And I have two very busy professionals who have joined me right now, and it's really good to have Dr. Hisune and Dr. Bassi with me today. Good morning, ladies.
Good morning.
Thanks good to have you in here with us on the Q today. You guys are both busy, right? Isn't that what I heard? We have, what I heard just a minute ago, we have somebody in labor.
We have two patients in labor. That's correct.
That's not a good thing. And yet, so you have patients that are maybe going to call you away at any second right at this point in time. So we will use our time extremely wise here this morning, and we thank you for both being here.
Thanks for having us.
I think everybody in the radio world has heard both your names because you're both recent members of our community. Mm-hmm. You both have moved in here in the last year or less,
That's right.
roughly.
Mm-hmm.
And so whenever they come in, your marketing department, and we won't name any names or anything, but we'll point back from behind you. You know what I mean? The
right.
one that she does a really good job of getting your names out. So
That's
I think
true.
everybody has heard your name if they've not seen your face.
That's right.
And so it's wonderful to have you here today. Let's start, Dr. Hisune, let's talk a little bit about your background. Where are you from originally? How did you end up in Bryan?
Absolutely. So all over the place, but basically have come from the Michigan area, from Ann Arbor and Livonia. I trained at the University of Michigan and then worked there for about 7 years, and then decided with my husband that we would need a change, and this was it.
Wow.
So here we are.
I think most people would say you came from Ann Arbor to Bryan, Ohio.
That's right.
Yeah.
Is that what? Have you heard that a couple times, Dr. Hisune?
Yes, and I am proudly sporting my Michigan gear,
Ooh.
even though I'm getting called out about it.
Well, we might have an announcement for you here in the not too distant future that will make you and a lot of Michigan people happy. But I'm
Okay.
not allowed to say anything about that.
Oh, boy.
I mums the word here right
Okay.
now. Okay, but we were wondering, we were speculating about whether or not there was any Michigan gear there in your office, and now we know the truth.
Oh, yes.
Well, we're okay with that. How's that? I'm an Ohio University guy, so I have no dog in this fight whatsoever.
Perfect.
Okay, we used to call the Ohio State fans the guys up north because we were down in Athens, Ohio, so they were north of us, okay? And they'd come south to see us most of the time. We never went back up north because of it's Ohio State. Dr. Bassi, a little bit about yourself. Where are you from?
So I also come from Michigan. We lived in Dearborn, and I worked at Ann Arbor at University of Michigan. And before that, I was North Carolina, so also not in a rural area at all. But when we came to Bryan, my husband and I and kids liked the area. It's nice and peaceful and quiet, and we were never really big city people.
Sure.
So we liked it here.
Well, we like having you here. How's
Thank
that?
you.
So welcome and thank you for coming into town.
Thank you.
Thanks.
We were talking a little bit about that before you got here because I found it amazing that two folks with your credentials, okay, because man, I looked at your history. They kind of gave me somewhat of a resume on you. You know, I kind of struggled my way through 3 3/4 years at Ohio University. Came out with a bachelor's degree in BS in communications. Okay, BS in communications, the important situation. But you know, why would you come to a little town like this one? I think you hit on it just a little bit, but I think in most of us, we're all sitting there saying, "Wow, we really got lucky here."
Yeah.
Why Bryan?
I think, you know, it's luck. It's meant to be. I didn't know about Bryan. I didn't know it existed.
Okay.
You know, I was approached by a recruiter, and we came by to see the area. No one around me in Michigan really knew where Bryan, Ohio was, so we didn't know where it was or what it looks like until we actually came here. And we fell in love with how peaceful it is and quiet, and we were just fed up with traffic and how busy the lifestyle is in Ann Arbor and in Dearborn, Michigan, and we wanted a change. And I asked everyone, and everyone said it's perfect for family, and that's what matters to me, myself and my husband the most, since we have 4 children. So we just like that it's nice and cute and quiet.
There you go. Dr. Hisune, you guys have now, you know, I guess a full staff. I mean, with both of you here, that's somewhat unusual to have 2 OBGYN doctors like yourselves in a small town like this, is it not?
It is, but you know, there's what I'm slowly learning over the last 3 or 4 months that I've been here is that there's need. I think Phil Ennin, the CEO of the hospital, had a vision that is really accurate. There's a need for good OBGYNs. I'm going to say that about ourselves, if that's okay.
Sure, no.
And female OBGYNs, just from hearing what the patients who are streaming into the clinic are asking for. They're also asking for consistency. They're asking for, not to have to travel very far for services. Just to give you a sense, I've seen a 5-year-old in my clinic last week.
Wow.
With issues, and I've seen patients up into their 80s, and that's what our clinic is meant to be. I'm not saying that I'm perfectly trained in all aspects of OBGYN, but I'm comfortable enough to triage and to provide those services to people who are further away from the large medical centers, which is where Brian is, and to work within the limitations of what we have in our small hospital. So that vision actually was fantastic, and I think this is what this town needs, and probably, in the next year or two, I think we're expected to even grow more.
Yes.
Because I think there's a patient need, and hopefully the services that we provide to these women are what they're looking for, that they bring in, patients in for the care that is needed for them from even neighboring towns and areas.
Sure.
That and, why we made the move here, I think everything, just like Dr. Bazzi said, it's meant to be. Sometimes certain things knock your door, but they're not at the right time.
Right.
And so you don't take advantage of them. And then this opportunity knocked our door at the right time when I was looking for a job change. I was looking for an environment change, and I never considered that I would move to a rural town like this. But my husband and I looked at each other and we're like, do you think we can do this? And I'm like, sure. I mean, I've done a lot harder things, right? I went to medical school. We trained in OBGYN residency. We can do this, and we are doing it.
That's the important part.
That's right.
Dr. Hasude, Dr. Bazzi, my guests here during the medical hour today, we need to pay some bills. I think Phil probably talked to you about that when you were at the hospital, too, about paying bills, because that's the kind of guy he is. We need to do that here, too. Let us step away for just a minute. When we get back, I'm going to get into the day-to-day life and what is going on with your clinics. We are very fortunate to have two very fine doctors with us today that are part of the medical specialty clinics of the Bryan Hospital. When we get back, we'll think about what a day's like in the OBGYN ward here in Bryan, Ohio. It's 27 after 10 on the Q.
Your point of pride, your place of
And it's about 29 minutes after 10 o'clock right now. I have Dr. Bazzi and Dr. Husseini with me right now, and I will butcher your names because I butchered my name, and it's just part of the way that it happens. Have you ever heard of a guy that has one living brain cell, ladies? I mean, is that medically possible? I guess what I'm going to ask that now before we go any farther, because that's exactly what I've been diagnosed with. It's
Oh,
just
no.
there's only one left.
But it's working,
It
so
works
it's good.
extremely well,
you
except
go.
for remembering people's names,
Oh,
certain
goodness.
dates, okay, where I'm supposed to be, where my wife wants me to be, which is the important thing, and how that works, those kind of things. And then I always just say, dear, it's just that one living brain cell problem I've got right now. On a day-to-day basis, guys, and I'll throw this up to either one of you two. What happens in your clinic every day? What's the most prevalent thing that you deal with on a day-to-day basis?
So we'll kind of tag team this, but
Sure.
So we have our annuals, our regular well woman exams from anywhere from the teenage early 20s to the late 80s. We have our prenatals for pregnancies, but we also have specific complaints like vaginal dryness or issues with menopause. We have bleeding after menopause that we usually evaluate. And Dr. Hisune has seen a couple of interesting cases in the past couple of weeks as well with vulvar issues.
Okay, all right.
So, our doors are open for whoever comes in. But every now and then we do see like breast issues as well. So we've seen a good variety of a whole different type of female-related complaints and concerns.
Sure.
Yeah.
And what was happening before you guys showed up? I mean, where were these folks going at that point in time?
Unfortunately, people go to like places like Toledo or Fort Wayne, or they do, as Dr. Hisune had mentioned before. I do have patients that say, yes, we drove. They drive an hour and a half, or whatever it takes to get somewhere where they can get specialty care.
Yeah. Well, I'll tell you what, it's good that they can come to Bryan now, that's for sure.
That's right.
There's no doubt about that. Pressing issues around our area right now, Dr. Hisune, are there real issues and problems that we're facing, or younger and older women are facing in Northwest Ohio?
I think just to add to that, the issue is that some women don't come into the doctor until something's wrong.
That's correct.
And so a lot of what we're seeing is now that we have a space and time to see those patients, and for many of them there's also a female provider, which not all women have that preference, but many do. They're coming in saying, I haven't seen a doctor in 10, 15 years. I haven't had a pelvic exam in that long. And some recognize they just need to come. Others come because they start to have a pain or an itch or bleeding, etc. And what I say is, please come and see us if you have any concerns like that so we can work through them. But come and see us every year before the problem presents itself, before it gets to be really big. I've diagnosed at least 3 cancers in the 3 months that I've been working. And not to say that those cancers wouldn't have been diagnosed, if there was someone else working in my spot, but some of these patients either got turfed around from one doctor to the other, or some were in some denial that this was really going on, and they delayed coming in. Don't do that. Come in and see us. Even if your periods are gone, still come see the doctor. Even if you're told by your provider you don't need any more PAPs, or you don't need a PAP until 2, 3, 4 years from now, you still should get an exam once a year for a breast exam, a pelvic exam. We talk to you about menopause symptoms, which are awful for some people, and you don't have to suffer from them. You don't necessarily need to accept the treatment that I offer you, but at least you know it's out there for you. Painful intercourse, a lot of women suffer with that. Urinary incontinence, prolapse symptoms. And what I've started to learn about CHWC is that we really care about our patients no matter how high or low their income is, or no income at all, or no insurance at all. And so we will work to our best capacity to take care of you, regardless of how, what your resources are. Unfortunately, with this healthcare system in the United States, there are some limitations, but I want people to feel like they can come in talk to us. We'll work with you. There's been a lot of success with financial planning for patients who do have medical bills and need help with that. But don't let that stop you from coming in to get an exam that we all agree is not very pleasant, but it's necessary.
Yeah, right.
That's right.
Well, and you know, it's a shame nowadays that we do have to talk about dollars, though, isn't it, Tom?
That's right.
When it comes to our health, and it comes to, you know, being able to take care of somebody who is in need of some health issues and needs some treatment, and then have to worry about whether there is money there or not to pay for that.
Absolutely.
That's right.
And I would have to think that that is probably one of the number one reasons why people don't come.
Yes.
Now, any kind of symptom, though, that you have, it would scare me, okay? I mean, it would scare anybody. If you think, because I do think, do we not all think we have the worst? Oh my gosh, I've got that. I'm in trouble, you know? And I don't believe that's the case most of the time, but we do think the worst as a human race, don't we?
Absolutely.
Yeah.
Yep. And the internet can be our worst enemy.
Yeah.
Absolutely. That's
Can it be? Yeah.
Internet and other people telling them what you have, and then having family members diagnose you is also pretty dangerous and scary.
Well, you mean, so when I go up and I start reading the 10 things that you got to worry about eating peanut butter and jelly sandwiches,
That's right.
it may not be real? Oh my God.
Yeah.
No, so I guess that's the neat thing. And I think the thing we also need to say probably is, because this is unusual, there aren't a lot of doctors that are taking patients oftentimes right now, and both of you still are accepting patients and would love to see patients if they're out there.
Absolutely. Yep, that's true.
Which is really important as well, because that has become a difficult situation in the world that we live in right now. Unusual cases. Dr. Hasune, I think Dr. Bazzi kind of said that you had a couple that were a little bit unusual maybe in the last couple of weeks, or something a little out of the, not in the ordinary.
Some of that is patients who don't have regular access to care. But, you know, I've diagnosed someone with cervical cancer, which is pretty rare in this day and age because usually pap smears catch precancerous cells early and are treated appropriately, who had seen several specialists and really did not get the appropriate exam for both patient and provider reasons. I saw a patient who had a very large fibroid uterus that was about a 35-week pregnant woman's size. She went to Toledo because she needed specialized care for that. We saw a 5-year-old girl last
huge
week.
Polyp that you had too.
Yes, a large polyp that we're still working on removing for women who came in with postmenopausal bleeding.
Yeah,
interesting
I mean, I've
things,
diagnosed
but-
like vulvar cancer. Someone didn't know that she had a huge mass or was in denial, if you may. That was also pretty significant that we both were like, wow. And so she was also, you know, anyone that needs subspecialty care like GYN oncology, like the cancer specialist, or if they need specialists, at least as Dr. Hasune said, we triage, we diagnose, we refer when they need that subspecialty care at larger academic hospitals, and we're very comfortable recognizing that and referring as needed.
Yeah.
So
Now, being a man, you know, I don't have to worry about this, but I have seen and heard a lot of women tell me that the Pap test, the Pap smear nowadays, either isn't reliable, okay, or, you know, obviously it's not the most fun thing to do in the entire world, okay, or is really of no value to them in their health plans, okay. So let's talk to that. Why are those fallacies? Well, the middle one, I guess, is not the most fun thing to do, so we'll go along with that one. But the other two, where somebody says, you know, no, they're not reliable, and I really don't need to do that.
it is the most reliable and the only thing for screening for cervical cancer. And a lot of people are afraid of the exam, but after they have the Pap test done, they're like, oh, that wasn't so bad. Some people have had bad experiences before, but when they come to our clinic, I mean, I've had multiple patients say, oh, that wasn't that bad. And when you think about it, this day and age, women that are in their 30s and beyond, if we usually do a Pap test, which is the same swab for the patient, and we send it off to look for the cells on the surface of the cervix, as well as any presence of the human papillomavirus, the HPV. If both of those tests are normal, they only need it once every 5 years. So it's not... I would, you know, definitely go with that little discomfort if I can screen a pre-cancer or even a cancer and save someone's life. I think it's totally worth it.
Yeah, yeah. You brought up HPV, and there's an awful lot of controversy as to whether or not I want to have my child vaccinated. Thoughts on that?
We absolutely recommend that
Okay.
every boy or girl starting at age 11 up to the age of 26 should get the HPV vaccine, because again, it's one of the few things that we can do to help prevent someone from getting the high-risk human papillomavirus that is the cause for cervical cancer and other cancers in the genital area. So
Yeah.
absolutely. I mean, my daughter yesterday got her first HPV vaccine, and she's only 11.
Okay.
So the soon as she was able to get it, I gave it to her. Like I mean, took her to her primary care provider, and she got it.
Sure.
So we definitely believe in that.
Yeah.
Absolutely.
There are an awful lot of folks that are worried about these vaccinations and what's in these vaccinations, okay? And you hear horror stories. Oh my gosh, there's this in there, there's that in there.
Right.
You guys very comfortable with what we're doing at that point? Yeah.
You know, the hashtag that goes on the internet is very true. Vaccines save lives. And we're not talking about just the HPV vaccines. We're not pediatricians, so we don't really, you know, have knowledge or administer vaccines for children, of course, other than taking our own children to be vaccinated.
Sure.
But we wouldn't all be here without vaccines. We would all be dead from smallpox, and we would be limping around from polio. So we have to think about that. The stories that have been circulated for many years about autism, etc., related to vaccines are due to an incorrect study from an unethical doctor in the 70s. And so these are inaccurate representations that still are propagated. And that is why we're starting to see more children with, you know, outbreaks of measles and mumps, things that we were never diagnosed before because there's many unvaccinated in the population. The other, and this really applies to the HPV vaccine, is the concept of herd immunity. And this is why the CDC has started recommending influenza vaccines for everyone, which was not the case about 3 to 5 years ago. Now we're vaccinating everyone because if I don't get the flu, then my child doesn't get the flu, and my immunocompromised patient doesn't get the flu, and my 90-year-old grandmother doesn't get the flu, because no one is getting the flu. And it's a very safe, inactivated vaccine. We give it to all of our pregnant patients because we know that patients who are older, immunocompromised, children, and pregnant women die almost 10 times higher from influenza. I'm talking about death.
Wow.
Death from overlying pneumonia in the ICU, intubated, dying from influenza. And so the HPV vaccine has the same very novel, very interesting concept, is that someone said, I don't have a medication for this virus. I can't make it go away. Once you have contact with a sexual partner that gives it to you, you're asymptomatic from it, and you never know that you have HPV. So for those folks out there that are thinking, my pain is from HPV, I have this, zing, my periods are funny from HPV, that's not the cause. HPV is asymptomatic until you start to have a cancerous lesion from it. And the concept of pap smears is to try to catch those precancerous cells earlier and treat them before it turns into cancer. But I don't have a drug to give a patient to say, your HPV is cleared. I'm relying on their immune system to do it. And so what a novel concept to say, I'm going to give my child an HPV vaccine so that they never have to deal with this. And what the target of the vaccine is to vaccinate for the 4 most common subtypes that cause warts, genital warts, which are not cancerous, but they're awful. And 2 most common subtypes that cause about 75% of cancers. In 2015, we have a new vaccine that vaccinates for 9 of the subtypes, so 2 that cause warts, and then the 7 most common that cause high-risk cervical, vaginal, anal, penile, testicular cancers. And those things are real. They do happen.
How common are they nowadays? I mean, how many are there percentages that we can quote as far as how likely are we to come up with any of these cancers?
So it depends on screening,
Okay.
but about 80% of girls and boys between ages in their teenage years, from
Okay.
21 to 30, are positive for HPV at some point.
Really?
80%. And
Now, okay, that's how? Why that large of a number?
because it's common. It is the
Very
most common
abundant.
sexually transmitted disease.
Wow.
It doesn't have a treatment. And that's where that age range of vaccinating, so the vaccine is approved from 9 to 26-year-olds.
Okay.
In males, it's 9 to 21, although it should be to 26. But the point of vaccinated kids at age 11 is because most kids at that point haven't had any sexual contact.
Sure.
Once you have sexual contact and you acquire one or more of the viral subtypes, the vaccine doesn't protect you anymore.
Sure.
Because you can't acquire immunity to something that's living in your tissues. We still give it up until age 26 because if you've acquired HPV 16, I can still immunize you to HPV 18 and 51 and 55, et cetera. So there's still some benefit to it. But, I saw someone yesterday in clinic who is 23, was on her 3rd episode of chlamydia in the last 4 months due to multiple partners who were unfortunate to, give her that. Unprotected intercourse, of course, although you can get HPV even from outer contact without having any penile penetration of the vagina. Just without using a condom, you would basically get HPV just from that. There's also an increasing prevalence of oral and throat cancer from HPV because of oral sex. It's coming into the Dr. Nazanoff, our ENT specialist, will tell you lots of polyps, warts, and cancers of the throat. That is the new thing.
More and more.
Oh my gosh.
So the 2 things that you can do as a person to protect yourself from HPV is 1, vaccinate as early as possible and get the entire series. If your child is vaccinated for HPV before the age of 15, they only get 2 doses because it's that effective at that age.
Okay.
If the child starts the vaccine after age 15, they are required to get 3 to get a full set of them. So early as possible so that you also catch the child vaccinated before they start to get exposed to the virus. And the second thing is don't smoke.
Really?
There's something about cigarette smoke that affects our immune system and does not allow the tissues to clear HPV.
Okay.
And people are saying, well, I don't smoke that much. I'm sorry. 1 cigarette is enough. If you have a pack or you have a lighter in your car, you are a smoker. 0 smoking and as minimal second exposure to smoke as possible. For a variety of reasons, but if we're talking about HPV, that is key. If you are in your doctor's office because you have an HPV-related complication, whether it's warts or precancer or cancer, stop smoking.
I'll be darned. I'd never even heard that or thought about something like that. That's amazing. Well, I don't smoke. Okay.
Good.
Well, that's good. I can check that off the
I
list.
gave that up about 34 years ago. How's
good
that?
for
It's
you.
been a while ago. How's that? But so that's a good thing. Okay, so an old guy like myself, there's a possibility still for a person like myself to contract this disease as well?
If you have new partners.
Yeah. Okay, so
Yeah.
So, where'd this come from? I guess that's a question I've always wanted. What happened here? And what happened to the good old diseases that we used to have to worry about? You know what I mean? It just keeps there. This is like, like some of those on steroids, is it not?
We're surviving those other diseases, and so this showed up.
Yeah.
The gonorrheas and all those kind of things that we always had to worry about when I was a kid. Nowadays,
We still worry about
they're
them.
still there?
They're still there. Absolutely.
They just get treated with an antibiotic.
Okay, and basically with no problems.
Yeah. Unless the only issue with those is antibiotic resistance is starting to creep up. But
Sure.
other than that, they're treatable.
But the human papilloma virus
Is not treatable.
Is not treatable at all.
right.
Where'd it come from? What happened? Do you know? Do we know?
Originally? I don't know. There's hundreds of subtypes of HPV.
Yeah.
And it doesn't cause cancer within a couple months or a year. We're talking very slow growing to cause precancer and then to cause cancer. We're talking 10, 15 years, 20 years. That's why we urge people to see their doctor on a regular basis so that if we do see a lesion, they might be coming for something totally different. And we might incidentally find something on the vulva or somewhere on the genital area, and we might biopsy it. It might come back as a precancer. Well, then we take it out, and then that way we don't have to worry about it developing into cancer. The concern is if it's there and no one sees a doctor regularly and it goes years and years and years, and then that HPV starts replicating the cells and becomes a precancer, and then they also don't see anyone. Eventually they're going to get cancer. So I don't want people to also be listening to us and think, oh, if I have HPV in a couple of months, I'm going to have cancer. That's not the case. As long as they're having follow-up, regular follow-up to make sure that there's no precancer, hence the pap test for the cervical cancer, then they should be fine.
Yeah. have we just gotten sophisticated enough nowadays that maybe these things have always been there, but we could never detect them in the past?
People
Is that
died
possible?
of them. People
Yeah.
died of the cancer.
Yeah.
Before.
Now people
before.
are living with it because we're
Yeah.
catching it early.
And, well, and that's, I mean, the other side. But I mean, the HPV maybe has been here forever. We just weren't able to detect it. It,
Yeah.
it was killing people in the past, but we just said it was cancer. It was not. We didn't know. What
It was the
causing
cause of
at
it.
that point.
Yeah.
we,
It was the
we
cause
knew
of
the
cancer.
result, but we didn't know what the cause was.
Absolutely.
My
Correct.
middle son is a researcher down at Ohio State. He's at that other school now. How's that? Huh? And he does research like this, and they are into AIDS research, and he was at in Cleveland at Case Western, and the doctor that they were working with at that point in time, they decided that you couldn't get AIDS orally, which was a very strange situation. And then they, through research, found that they had a protein in saliva that basically suppressed
Absolutely.
the original virus, and so it's amazing what you guys are finding nowadays, and it's mind-boggling. All right, Dr. Hasune, Dr. Bazzi, I have to pay a couple more bills. I'm going to keep you here for just a couple more minutes. How's that? Hopefully
great.
the baby will hang around for just another 10 or so, because I'd
That's
like to
fine.
get into the other side of this thing for folks who are maybe trying to have children and not having any success, because I know you work with folks like that as well. We're in the medical hour right now. It's all brought to you by the medical specialty clinics at the Bryan Hospital and the community health professionals.
This weekend
Time is
in
it?
Montville.
Final minutes here on our medical show here today on the Q, all brought to you by the medical specialty clinics at the Bryan Hospital and community health professionals. Dr. Hasune and Dr. Bazzi here with me today, and Dr. Bazzi, is it Bazzi?
Bazzi, that's right. Yeah.
I bounce back and forth.
It's okay.
One
It's close enough.
Okay, we're close. My last name's Funderburg. I can't get that out most of the time anyway. How's that? It's kind of scary. Both of these doctors, part of the OBGYN clinic here at the Bryan Hospital. And I've been very happy and fortunate to have them with me today, because they have a couple of new members of the Northwest Ohio team that are about to be born here at any point in time. And we're kind of putting them off while we get a chance to talk. Let's talk a little bit about that other side before I let you go today, because there are people out here in this world who try to have children and can't. And that becomes a very difficult situation, and it's also something that you guys will help with and deal with on a day-to-day basis.
Absolutely, that's right. I've seen multiple couples since I started in September of 2017 now, and some of them are, simple cases where it's just that a patient has irregular periods and she's just not catching the time that she is ovulating, and it's as simple as some counseling, some suggestions. I do some preconception counseling, making sure that the patient is the healthiest version of what she can potentially be before she gets pregnant. and just give some advice. So some are pretty simple, just with some advice, just buying some over-the-counter things that she can have timed intercourse and help her get pregnant. Others, we need to evaluate a little bit further, and we need to evaluate the lining of the uterus, and if her fallopian tubes are open, as Dr. Hassouni had mentioned, there is an increased risk of gonorrhea, chlamydia that we're seeing in this area. And for, if someone is a teenager and had gonorrhea, chlamydia, and maybe didn't know about it soon enough or wasn't treated, where there was a delay, there could potentially be scarring to the fallopian tube, and that could be the cause as to why someone or a couple hasn't been able to get pregnant. I always counsel my patients that a couple is not considered to be infertile until they've been trying for 12 months. So no, you are not infertile if you've been trying for 4 to 5 months and you have not been able to get pregnant. This is typically based on like females that are less than 35 of age. Once they're over 35 of age, then we say, okay, 6 months, because the time is ticking and we need to, find out why she hasn't gotten pregnant. But usually it's 12 months of trying to get pregnant. So then if we are worried about the fallopian tubes maybe being scarred down, there's a procedure that we offer at our hospital where we can evaluate her fallopian tubes and see if they're open. Sometimes if I feel like the issue is from the partner himself, then we can refer to urology and they can do a semen analysis, because I always explain it takes 2 to tango and there's multiple different factors that go into fertility. So we need to evaluate that. And if if we do all of the initial steps that we can do and offer everything that our hospital has to offer, and we feel like this patient needs in vitro fertilization, for example, then we absolutely refer out to reproductive endocrinology and infertility so that they can have a consultation if IVF is an option for them. But there's multiple different things that we can try before that. Wow. At least for evaluation.
I have a very good set of friends who used to be here in Bryan. Now they're down south in southern Ohio, but they tried for years and years and years and years. And then all of a sudden they had two
spontaneous
of the cutest little girls you've ever seen in your entire life.
That's amazing. Yeah.
It is amazing, isn't it? Huh?
Yes.
Where do you guys stand with all the embryos, the frozen embryos, and those kind of things? I mean, have you ever been part of that process and that procedure?
Well, we both, part of our training, we train through reproductive endocrinology and infertility. And at University of Michigan, there's an amazing, department for reproductive endocrinology and infertility. So yes, we've been exposed to that technology. Typically, personally, I just leave it up to the couple, and I respect their wishes. We don't freeze any embryos ourselves. Clearly, we don't have that technology, but I respect whatever the patient, whatever their belief is, then I respect that. Yeah,
wonderful. Well, I'll tell you what, guys, it's been a very short hour, and they always are, okay? And I appreciate your time and all the great things that you're doing, all your work. Please come back and join us at some point in time. It's wonderful to have an OBGYN department here in Bryan, Ohio, for Northwest Ohio, and to be blessed to have two fine young ladies like yourself to be part of this. Man, we are very fortunate to have you guys here in Northwest Ohio. So thanks for spending out a little time with a guy with one living brain cell. Okay.
Thanks for having us.
Have we missed anything before I let you go here today? Is there? I know we want to give maybe a phone number out if somebody would want to contact you guys.
Absolutely. We are open Monday through Friday. And, please call for an appointment, or if we can help you triage something. We're open 8 to 4:30 and all those days, and our number is 419-633-0755. I'll say that again, 419-633-0755, and this is the Bryan Hospital.
So it's really easy, you guys. That's the neat part. Some folks are over across the street or over here or over there.
Yeah,
but you guys are
very
at the hospital
simple.
there.
We're at the hospital.
Very simple for you guys.
Yep.
Dr. Hassouni, Dr. Baze, thank you very much for being part of this today. That'll wrap up our medical program today. It's all brought to you by the Medical Specialty Clinics of the Bryan Hospital and the community health professionals. And that will do it for another medical program here on this Wednesday. Don't forget we have a band concert preview coming up shortly. And you and me and classic hits all the way up until noon here today on the Q 96.5 FM. Very good.
Awesome.
Thank you.
Thank you very much.
It's an exhausting job that you have.
Yeah.
Oh, I don't think it's more exhausting than what you guys do, though, huh? Come on. Good, wonderful to meet you guys. Thank you.
Thanks so much for having us.
Come back, please. Okay. If you have anything that you guys want to promote, or something's coming up, or something you want us to let people know about, we'd love to have it. Okay. All right.
Thank
Very
you.
good. Good luck with the deliveries.
Thank you.
Are we looking at? Are there two? Did I hear two, or just one?
Yeah, no, I have 2 in labor.
Okay.
And maybe someone was coming in as we were coming this way.
Oh gosh. Okay. And you call my life exhausting. See you guys. Lost track of that time. I would. Jen, yes.